My name is Professor Flavia Senkbuge. I am the Acting Deputy Vice Chancellor Student Life and also Deputy Dean Stakeholder Relations at the University of Pretoria. And this afternoon I was the keynote speaker for the 21st Matthew Lukuya lecture. And as I was saying in the audience, it's a great honor for me to be here, particularly being indigenous Ugandan in the diaspora. And so really one of the things that I was talking about was creating a new architecture, particularly for pandemic response. And I think for such a long time as Africans, we have really had a playbook that wasn't the right fit for us. And so I proposed an architecture that has got three pillars, that has Ubuntu, which means I am because we are, Harambe, which means that we collectively work together. And really this was a call to action to work together and leverage on our excellence. And the last one was Al-Kebilam, which was to decolonize our health system and make it more fit for purpose. And I believe that if we can adopt these three pillars as our own, we will be able to deal with not only emerging pandemics, but also the global health challenges and those that we face in Africa. And also revitalize primary healthcare, because that is the first point where our populations in fact seek healthcare. And I believe that part of the decolonial project is really to deliver care where people are, so that they don't have to travel such long distances in order to access healthcare. And so I'm proposing a re-looking at our architecture and really thinking to ourselves, is this health system really fit for purpose? We've got all these hospitals, all these clinics, but is there a space for us to rationalize and say, are they fit for purpose, and are we having the health outcomes that we need? Young and vibrant and exceptional, talented young minds, we're going to lose them to the global north. And so the investment is not only just in their education, but the investment has got to be in saying, if we have trained somebody who is an ENT surgeon, we also have to create the infrastructure to support that person to carry out some of the most cutting edge surgeries that are there in the ENT field, be them surgery, psychiatry, you name it. And so investment in, I very much am a proponent of investing and grooming our own timber, particularly in the areas of, yes, clinical expertise, but also in research and development. Because if you look at it, most of the data is collected by our young people. They have the lived experience. The professors as well are actually, some of them, as I was saying in my keynote speech, the top minds of HIV and AIDS, malaria, communicable diseases are actually here in Africa, and we can ill afford to lose them. That's why I'm a firm believer in investing heavily into our own health professionals.
Whereas we have built capacity to be able to respond to the epidemic, there are many facets. We need the legal to support us. We need the law to support us. We need security agencies to support us to enforce. We need disease surveillance officer to support us. But more importantly, we need the community. The disease and outbreak starts in the community. So that people should be empowered or educated to be able to alert the next level, that there's something strange happening in our community. There are people dying we don't know. There are new people who came in from another country. They are having signs and symptoms of something strange. That kind of rumor gives us the first information for us to investigate and work on. In the most recent outbreak, we didn't get that rumor in time. And even when we got the rumor and we had started managing the outbreak, some people were not satisfied with where we buried one of their person. So we need to have community engagement with dignified burial teams. Whereas we are burying people, a group exhumed the body. Once you touch a body which has had an infectious disease, it can rapidly spread the disease in the community again. So whereas the disease was being managed, that happened. And so we lost the games because now 6 people got infected because they participated in that. What am I saying? As a country, we need to start believing in our leaders at the community, what they tell us. We need to work as one, Ubuntu, and we need to know that we exist to help each other. There is no government which will stop outbreaks as a government, because there are no people who belong to government. The people and children belong to us as individuals. In research, but also to come up with researcher hubs, innovation hubs for science. There are young people innovating many things, medicines, combination hubs, assistive devices, all these hubs, incubators, diagnostic kits, so that they cannot compete in the open market unless we give them a platform as a country to allow them to grow their young technology and innovation. So it's upon us as government to seek money and also create an environment in universities, in governments, that we can support innovation. We need to develop our own vaccines, our own medicines for many diseases, because other people don't have the same diseases as we have in the tropics. And secondly, we should also work together with other countries around us for whom we have the same common diseases.
Thank you so much. And it gave us a lot to think about, and especially from Professor Flavia Senkobuge. She mentioned quite a bit of things that I think many have been thinking about it, and our role as healthcare workers, but as a nation and as a continent, what we need to do to stand and look forward. Because what we really need now is empowerment within ourselves to do what we need to do in terms of protection, in terms of prevention of diseases, in terms of early arrival at hospitals, and what we need to, how we can stand together as a sector, as a health sector, to protect life and promote health in the various ways.